welcome back to Conversations. We've been talking about migraines. Luckily, we don't suffer.
No, we get headaches once in a while. I mean, I know I get it.
You give me a headache, but that's very
amongst
different.
many other people.
That's very different from Dr. Zeev Peled and what he does. Dr. Peled is a cosmetic and reconstructive surgeon here in the San Francisco Bay Area, but doing something very different, and that is he's got a surgery for migraines. And, really having an unbelievable success rate. That's how we found you. Welcome to Conversations. It's great to have you here.
Thank you very much for having me. 35
million Americans suffer from migraines. And
That's
let's define, what is exactly a migraine?
That's a very good question. And migraines can actually be defined in a number of different ways. Many lay people would just sort of define it as a very severe headache that's debilitating in many ways. It really stops you in your tracks. You have to stop what you're doing. You have to lay down. But migraines can also be defined by their clinical characteristics. In other words, if you have a certain number of very severe headaches per month, if they are associated with certain characteristics, for example, some people have auras, flashing lights that they see, watering eyes, runny noses. If it is associated with other symptoms, for example, an inability to tolerate bright lights or loud noises, and if it really is debilitating in the sense that you have to just stop what you're doing, kind of go into a quiet room, take significant medications, sometimes narcotics, to try and make the headache go away, you can define a migraine that way. I think migraines or chronic headaches like migraines can also be defined by the fact that the underlying process is different in each person. So for example, in some patients, it may actually truly be a chemical imbalance in the brain, which is what is the underlying reason we have so many different kinds of medications that are used to treat migraines, because each medication tries to address a certain chemical imbalance. But it can also be defined, and this is where I come in, by whether or not there's actually a mechanical compression, something pressing on a nerve, in this case within the head and neck region, that can actually cause the pain that you're perceiving as a severe headache.
And that's what was going on then with how we found you through actually Robin Cartier, who's been on our show, and her daughter, a young woman, debilitated by migraines. And I've known Robin for the longest time, and there was just nothing that could be done. And this was getting in the way of school and everything.
And that's a very common.
So happy to find you.
And she's been great, and her daughter's done extremely well.
Yeah.
And her migraines were remedied with a surgery?
Correct.
The type you specialize in, right?
Correct. So the surgery, it's not one surgical procedure, it's any number of surgical procedures because, for example, the three most common areas where people suffer from migraines are in the frontal region, sort of the forehead, and the temple region, whether that's above the ear or sort of just behind the eyes, and in the back of the neck. And then some people suffer from migraines that are not so much sinus related, but related to problems inside their nose. And in all of these areas that are nerves, there are nerves that can be pinched or irritated, and sort of like in carpal tunnel syndrome, as you'd mentioned earlier, when you have pressure on a nerve, in this case you relieve that pressure after identifying which nerves are causing the problem. And patients often do very, very well. And Robin's daughter is a very common story. The peak incidence for migraines, at least in this country, is between the ages of 25 and 55. So it's really a disease process of young people that strikes them down in the prime of their lives. And her daughter was in high school and had to drop out of class. And these are the kinds of stories you hear all the time. And it's really one of the things that makes being able to do this kind of surgery so rewarding, because you literally change people's lives. They come back to what they want to be.
Somebody on your website, and I think it was actually a news story that was done, so I happened to see it on your site, but she is a different person, this woman. She's just running down the stairs, everything, and she describes her life before.
Right.
And there's days where she didn't even want to live, just didn't want to go on. Can you imagine every day of your life, you can't take care of your children, you can't take care of your responsibilities, you're calling in sick to work, you're all the time feeling awful, and now she feels great.
I can't imagine. I mean, once in a while you get those types of headaches. I'm not a migraine sufferer, thankfully, but sometimes you get those types of headaches. It's just pressure building up in your head and stress and the culmination of all these things going on in your life, and it's debilitating. And for someone like that individual to go through that on a day in and day out basis, to all of a sudden be remedied of that pain, is it's life changing. Of course, it's life altering.
And it was her particular case, if I'm thinking of the right person, was really rewarding because she had one daughter and really wanted another child. But because she suffered so much, honestly didn't feel she could take care of another child with additional stress and all the things that are involved, lifting a baby, which can be heavy. And so after we operate on her, she actually is now migraine free. She was able to get pregnant and now has a second child.
Isn't that great? So, I mean, her life, you just changed her life completely.
Your procedure now, describe the procedure a little bit. You said that you relieve pressure on nerves in the back of the head going into the brain.
That's right. So let's take an example of a problem with someone who has migraines caused by a pinched nerve in the back of the head. The first thing you have to do in this process is identify which nerves are causing that problem. You can actually do it in a number of ways. You can use a local anesthetic, so it's called a nerve block, to try and basically numb that nerve for a little while. And if you happen to come in the throes of a really bad headache and we're able to either shut that headache down or significantly reduce the discomfort with it, that helps in identifying that that particular nerve that you blocked is a significant cause of your pain. Another way to do that, because not everybody who suffers even from severe migraines that are very common has them every day, you can actually use Botox. Now a lot of people say, well gosh, why Botox? Isn't Botox used for cosmetic reasons? And of course it is, but it wasn't invented for cosmetic reasons. It was actually invented to treat something called blepharospasm, which is spasm of the upper eyelid muscles. And in the case of headaches, what we can do is, and specifically in the case of the headaches in the back of the neck, we take Botox and we inject it around the muscles that are actually pinching the nerve, with the presumption that these muscles are actually spastic and actually causing pressure and irritation of that nerve. And by relaxing those muscles with Botox, you're still able to function normally, but yet the pressure on that nerve caused by those muscles is less. And if you then experience a similar decrease in the frequency, severity, or duration of your symptoms, we have done chemically what we can then go and do surgically by removing a piece of muscle. And people always say, gosh, you're removing muscles in my neck, I won't be able to move. We're actually talking about a muscle probably a piece of muscle the size of your thumbnail or your pinky nail. So it's essentially a muscle biopsy, but these nerves are not very big, so creating just a little bit of room around them enables them to kind of move and glide back and forth in the head of the neck without all that pressure.
And the Botox relief says on a temporary, oh yeah, we hit the right nerve.
That's correct.
Okay,
that's exactly
and
right.
then you can go in there, get to it, and it's a permanent
Is that typically
solution.
the course of action, is you do the less invasive first and try and isolate the problem, and then you'll go in with surgery?
That's exactly right. And it's not so much less invasive as a diagnostic maneuver. In other words, people often come and tell me, I have headaches both in the back of the neck, the temples, and the front. And the question is, okay, because sometimes it's really trigger points in all areas, and you have to eventually operate on nerves in all areas, but many times there is an inciting cause. So for example, people will have severe headaches that start in the back of their head, and when they really blow up and get to the point where it's a 10 out of 10, they feel it everywhere else. And so if you're able to identify that the areas in the back of the neck called the occipital nerves are the actual inciting cause, you let's say use Botox for them, which is going to last anywhere from 1 to 3 months. And if over that time period, all of a sudden the patients are saying, gosh, I used to have 15 of these horrible headaches a month, now it's down to 2 or 3, and they're not all that bad, we have now done chemically, by relaxing the pressure on those specific nerves, what we can then do surgically to hopefully give you that same degree of relief on a permanent basis.
Who would have thought, Botox was always, assumed it was help get rid of wrinkles, plump your lips,
but that would help
whatever
too.
else,
I hate it when I see that big wrinkle back here on people. That I'm kind of seeing the second use for that. But how did you get from doing, plastic surgery to doing this?
Yeah, it's a very common question, and actually many people don't realize that plastic surgeons not only do a lot of cosmetic surgery as I do, but also do a lot of reconstructive surgeries you'd mentioned earlier, for example, breast reconstruction after breast cancer. But in a lot of the plastic surgery training programs, you also get a lot of training in hand surgery. So for example, we're the ones that are always called in to put the fingers back on after they've been cut off, put the forearms and hands back on. And of course, among the things that you need to do to successfully put a finger back on is you need to repair the nerves. So you have some experience with nerves in your training. And a few people, a little older and a lot smarter than me, basically said, well, geez, we do a lot of work with nerves in the upper extremities, in the hands, the fingers. Carpal tunnel is a very common nerve operation. why can't we do these same sorts of things in other parts of the bodies, for example, the legs and now in the head and neck? And the answer is, of course, that you can. So when I was finishing my plastic surgery training at Harvard, I was trying to figure out what it is that I would do. I actually happened upon a colleague of mine who did the same additional training that I did in peripheral nerve surgery. And I ended up spending quite a bit of time with him, and I was just blown away by the kinds of things I was seeing. People with horrible pain in their feet, for example, secondary to diabetic neuropathy, were waking up in the recovery room, feeling their feet for the first time in years. Their pain was gone. People were moving their arms when they hadn't done that before. And of course, people were having horrible headaches who now didn't have them, or the volume was turned down significantly. And after seeing this for a little bit of time, I said, I have to learn more. And so spent a whole additional year doing just peripheral nerve surgery training, and that's where I ended up.
It's so great because, I mean, I know that the plastic and reconstructive and cosmetic part is so enjoyable to do. I've worked in that field before, but in this case too, the migraine thing, you're just
it's got to be
changing
so
lives.
I'm sure they're both rewarding, but this has got to be
you're
extra
just
special.
kind of
'cause you're
saving lives,
changing
aren't you?
I will say these are the happiest patients. You have a lot of nice cosmetic results. You have a lot of fingers that still work we've put back on, but these are the bottles of wine that you get at holiday time and the cards, and that's the good stuff.
Nice.
If you've got migraines or know somebody who does, you have just got to call Dr. Zeev Peled. Check out the website. It's very easy to understand, comprehensive. www.peledmigrainesurgery.com. That's PELED, migrainesurgery.com. Thanks so much for being on the show.
Thank you very much for having me. Really appreciate it.
And Sean and I'll be right back. We've got plenty more to talk about on Conversations.